So we continue talking about methods. So we're talking about the types of research. We did the introduction to research and we saw what research is all about. So in research method, this course has got three components. There is the research methods, there's epidemiology, and then there's biostatistics. So this is the research part. So in research, we already did the first part where we defined concept and then we talked about the types of, we've not yet talked about the types of research. That is today's class and also research approach, right? So if we say research, what do we really mean? Let's say, for example, you know a topic and then you are trying to find out information about that topic. Is that really research or it is not research? Is research only done for things that we don't know or it can also be done for things that we already know? So the ability to be able to locate and evaluate information, which is that's the main instance of research, and it's actually a skill. For it to be a skill means that we have to learn. So we are not born researchers. You get to learn, just like medicine itself is an art. You learn it. Why is research important? The knowledge that we are going to end up getting after we do a research is going to help us in clinical practice, leading also to medical practice that is evidence based. In pharmacology, at the end, you are going to do a topic evidence based medicine. So, some drugs are more used, some drugs are not used because we've tried them out. We use them based on evidence. What are the aims of research? Number one, to observe and describe, to predict, to determine, and to explain. There is something that you already know, but for you to be able to find out why, you are going to do a research. Just like right now, if you come and describe a lot of the pathology of a lot of diseases, they're going to tell you idiopathic, meaning we don't know the cause. We just find out that it has happened. All right. So for you to find out the cause of that, for example, if you come to women, there's something that is known as the polycystic ovarian syndrome. They're going to tell you idiopathic. What's the cause? We don't know. We'll just find out that okay, this woman starts developing. They'll try to give you a little explanation. No, the polycystic ovarian syndrome, the woman has got there's a increase in luteinizing hormone that causes an increase in estrogen, decrease in progesterone. But what is really the basis for all this? We don't know. So for you to be able to find out why, you have to do research, a proper research. And many things that we said some 30 years ago that we don't know right now, we know answers to them because of constant research. So, what is research? Research is a scientific inquiry that is aimed at learning new facts and also testing ideas. We call it hypothesis testing. So someone has already given their idea, the reason what they think is the cause for something, and then now you also come in to do a research to prove that what that idea someone has given is true or not true. That is research. At the same time, you can do the research to find out new facts, something that someone has never discovered, right? So research is a systemic search for information and new knowledge. The thing here is systemic because there are steps that you follow. Just don't do it. You just start from nowhere that I want to do research. And it's going to cover topics in every field of science, and perception of its scope and activities are unlimited. Okay? So again, research is a systemic collection, analysis, and interpretation of data to generate new knowledge and answer a certain question or solve a problem. This one is a very important definition. Systemic collection. When you collect that data, you don't just leave it there. That's why in medicine, right now at third year, you are doing clinical skills. In clinical skills, if they say take a respiratory exam, you are just going to say there is no scleral jaundice, there is no that, there is no that, there is no tobacco stains. You don't. The only thing that we are doing is that there is no. They said take a GI exam. You are going to say there is no leukonychia, there is no koilonychia on the hands, there is no finger clubbing. But then when you come to clinical practice, you will not be saying there is no. It's the same clinical skills you are going to be applying. But you are going to see koilonychia, you are going to see leukonychia. So now, what do you do with that data? Now that you have found that something is there, you have collected the information, you need to analyze the information and then you interpret it. If I see someone has got look on it here. What does it mean? Okay, this person has got liver disease. What can cause liver disease? You now start going into those. Okay, maybe you ask them, do you take alcohol? Have you been staying near water bodies? Maybe someone has got cystosomiasis. So you now want to interpret the data that you have. So that is important in research, collecting data, analyzing data, and interpreting the data in order to generate new knowledge and also answer a certain question or solve a problem. Research has got characteristics. Number one, it demands a clear statement of the problem. When before you start researching, you have to find out what am I trying to research about. That is you identifying a clear statement of the problem. Imagine you just started, okay, I want to do research. What about? What is it about? What do you want to achieve at the end of the day? So it should have a clear statement of the problem, and then it requires a plan. It is not aimless. You don't just do it aimlessly looking for something in the hope that you come across a solution. It's not like that. You have to be intentional, and then it builds on existing data, okay, using both positive and negative findings, like as we said earlier, hypothesis finding, testing. Someone already found out something, and then you're just trying to do more so that you can just make it more clear, or perhaps they told you some other things which are negative, and then you want to disagree because you feel this is not true, so you do research, and then new data should be collected as required and be organized in such a way that they answer the research question. So research question is very important when it comes to research. There are different types of research. We can broadly divide research into the basic research and applied research. Basic is necessary to generate new knowledge and technologies to deal with major unresolved health problems. That's basic. It is to generate new knowledge and technologies so that you deal with what is unresolved. Applied research is necessary to identify priority problems. So you have got a lot of problems. For example, if you come to the ward, you find out there are many, many diseases. But then, even the way the teaching is based or the diagnosis is going to concentrate more on the very, very common conditions. For example, if you go in Unit 3 on the ward, in internal medicine, where I've got pulmonology and infectious diseases, the major concern there is HIV, TB, hepatitis, because these are the guys that we are dealing with very, very much. Pulmonary embolism. But there are many diseases that are infectious in nature. Okay. So you want to prioritize problems and then design and evaluate policies and programs that will deliver the greatest health benefit, making optimal use of available resources. The reason as to why we don't pay attention to everything equally is because there's no much resource. So use the little resource that you have and then use it in such a way that you solve the biggest problems that are at hand. That is applied research. Now, research can either be quantitative in nature or qualitative in nature. When we are saying quantitative, we are trying to look at observations and measurements, okay, that can be expressed in numbers. That is quantitative. And then qualitative research is a kind of research where you're talking about things that can be expressed in numbers. For example, you want to answer a question, why? You can't express why question. For example, why did you come late? You can't express that in numbers. How come you did this? A question of how. You can't express that in numbers, right? So qualitative answers the question why. Quantitative answers the question how much. Okay, it's about much. So differentiate that. If you just say how, there should be the much there. If it's supposed to be quantitative, because that's what is going to answer numbers. Okay. So what is the purpose of research? Why do we do research anyway? As we said earlier, it is to establish or confirm facts, to reaffirm the result of previous work. You just want to, okay, what I did or what someone did is really correct, and also to solve new or existing problems, to support theories. You have got a theory that someone put down because they did research, so you want to support that, to develop new theories also, and to test the validity of instruments, procedures, or experiments. Testing validity, very, very vital. Okay. But when you are doing research, you are going to find out that the same question that you're trying to answer, one person is going to look at it in a different way. Another person is also going to look at it in a different way. Those are research paradigms. For example, if you look at this picture, someone might see a face, someone might see houses at the end, someone might be seeing maybe a person that is lying down, depending with what you're trying to look at. So, research, if you look at it at a very bigger perspective, you have got quantitative research, which deals with numbers, qualitative research, which are experiences, perceptions, feelings, and then you also have mixed method when you are trying to do research, where you are looking at both the qualitative aspect and the quantitative aspect. So, an example of a qualitative uh, research we can talk about, let's say, okay, let's start with quantitative. How many people are in this population with the disease? So you are trying to find out, you go and do research to just find out, let's say, the prevalence of a disease. How many people have been affected? That's quantitative. And then let's say, what makes people to be affected by that disease in that area? That is qualitative. Here, there's no numbers that you'll be putting on that question. Okay, so that is the first part that we have to understand.